Good afternoon. This is Dr. Bill Wyatt again with the American Orthodontic Society, and I'm going to talk to you a little bit about restorative dentistry and how you can mix orthodontics in with restorative dentistry. Now, if you haven't used these little bonded blocks you put in people's mouths to judge the height of the lower third of the face, you can open a dental deep bite where the teeth are over like that, and you push pressure, it makes them go up and these go down, but it will not elevate or change the vertical height of the face. And the way you do that was with blocks. You put these little blocks in the posterior part of the mouth, and you chew on those so much, and you use those to intrude the upper and lower teeth. And if you want to raise the vertical height of the face, you want to increase it, you put the block in the front part of the mouth and let the teeth back here erupt together, and that'll increase whatever they come together, it'll increase this vertical dimension of the face. But most of the time on high angle cases, you've got somebody too much vertical here, and you want to reduce it if you can, and you can reduce it to some extent with this. Just watch this case here, and there's some interesting things about it. If you haven't used these blocks, it'll be difficult for you to visualize what's going to take place in here. So study those cases. We've got a whole string of them there on using these blocks. Now, like you're jumping a crossbite out of the mouth, you put the blocks on the side with the crossbite, and you may open the mouth maybe a quarter of an inch to move the tooth over the crossbite. And by the time you get that tooth moved over, all these teeth will be in contact on the other side of the mouth. In other words, they moved together while they were sitting there doing nothing. As long as you kept them apart completely, they never touched during this time, they will move together in about maybe 2.5 months. These teeth will be in contact. You take the block off, and now you've got a quarter-inch gap over on the side where you had the crossbite. You got it out, and you say, oh my God, what are we going to do here? You don't do anything. You just keep it there, and then this thing will level back out again in just a short length of time. And that was really hit me when it did this. It found out what you could do with the teeth. Now, the teeth didn't come out of the bone just kind of moved with the teeth, and it went up and down. So we're not experiencing that in this particular case, but we have things that are just as remarkable here. And there's just a ton of this type of orthodontics in adult cases that people are scared to touch or something, or they try to fix it up without doing the orthodontics. But if you can learn to do the orthodontics, that's the far best way to do it. So let's get into this case right now. I've got to come over here, and this lady now has her whole posterior teeth are out back here. They don't touch. And so this vertical dimension of her face is down too much. And this squishes this, looks like it's squished up in this direction here. So we want to raise this up some and increase the vertical dimension of the face. And we're going to have to go in and work to put these teeth back in place where she's missing nearly all the lower teeth. I think there's one lower molar back there. So let's see about going to there. You look at it from the front, and very nice lady, smiles, and the lip line you see is just right underneath the nose. So we want to give her a little bit more the vertical dimension of the face here in doing the orthodontics. So just watch what happens here now. This is her teeth. Now her teeth is something she doesn't like to smile. I mean, she's got this big, huge diastema between the front teeth out here. And this is about all that hits, is these teeth right in the front of the mouth. So she's chewing with the front teeth, and she can't chew hard because if you put 10 pounds of pressure on these teeth, the joints back here at the back where the muscles are, you would have to put 20, 25, 30 pounds of force shared on the equal on the sides, but to get that to touch. Now none of these teeth have anything under them over here. She's got one tooth on one side over there. Now, if you're just thumbing through this and wanting to look at it, this isn't going to mean much to you. But if you're somebody who's serious about wanting to learn how to do adult orthodontics, study this case and study all those cases that where we've done the whole thing. I mean, where you see these blocks and what you can do with them. And you can do all sorts of things you wouldn't think you could. And we'll show you how to make them and how to take them off, so you will go. So not on this video, but there's many videos we've got on that. I'm going to erase that and we'll go now on her teeth. She has chewed this off and worn these teeth down. Now that's a cuspid tooth. That thing would have been down something like that, the lateral across here and the centrals and things. So she has ground these teeth off right here. So we wanted to know how much length we could give these teeth and not have her clack together while she's talking. In other words, we want the height in there that, where you touch them together, but they don't bang into each other every time you say a few words in there. So we have to figure out some way to restore this. And so that we'll show that here. All right, this thing is out of focus right here. I'm sorry, but you can see this. And we made these pictures back when we had to send the slides off. Now these teeth back here haven't had anything to touch for a long time, so they've come together. Even though they chew back here, and she may biting on it, or she may have had some type of restorative little flipper or something put back there. Let's go on to the next slide. Now here is the lower arch. We're just looking down on it, and you've got both bicuspids over here, and the cuspid, and it's worn flat down. These teeth have all worn off like this, and then you've got one bicuspid over here. Now here's a big tori, and kind of a tori in this area, which we didn't mess with. We just, you could have them taken off if they're not bothering them. Then most people would prefer just to leave them alone. There's a benign tumor, and it grows real slow. I've got one in my mouth that's about the size of a BB, and I'm just leaving it alone. And my father had some that was about as big as this, and we wanted to work on them. You just loosen the tissue here, lay it back. It looks like a knot on a log. You just grind it off, bring the tissue back up here and sew it back together in here. And you have to catch your grindings in here. You have a mouthful of them when you're grinding them off in there. And next, let's go to the next slide now. And this is the upper teeth. And these teeth are ground down into the dental structure of the teeth. And we're going to have to try to get this together. And so we're going to have to do something to pull these over and fill these in with the bigger laterals and try to make it look good. Now here's just the bicuspids are all that are coming in contact. You got both the bicuspids up here. Over here, the bicuspids out. They got bicuspid here and a molar back in this area, and there's nothing underneath it. So this lady has been eating with her front teeth, which is really hard on the joints. But she didn't seem to be having trouble with that, so she probably doesn't chew very hard, or she would have some trouble with the jaw joint. Now I want to go. Now here we went in orthodontically, and we. I don't have the pictures of doing this, but we figured how much space we were going to have to, length we would have to give, and we wanted to build something up in here, and we can take it down. It's just acrylic. This is a light cured acrylic that we bonded onto the teeth, and then you just shape it up into where it looks like teeth, and it just doesn't take too long to do this. And we put brackets on these teeth, and I put them up a little higher. You see, and we came out here and went up with that, and we got this occlusal surface coming off right like that. And this is the upper molar on that side. Now I'm going to go to the next slide over, and this is just her model, her models showing how she chewed and wore these teeth down. If you put the tooth back like it originally was, it would probably open this bite about that much, and these have drifted down. The bone and all has moved down with this. So we're going to build this back up, and we'll kind of get it to the height of the teeth here, or we're going to take the teeth down to about the height that this is, and then put a partial denture. Her dentist will do that. Now, this looks difficult to do, but it is not. You have to etch and wash and dry and stir, put this liquid material on there, and then just put you a roll of this material, and then you come in there and shape it up like teeth, and you can have the person bite tooth to a certain height, and then you need to stop them. Now, we don't have to have these teeth hit. If we're hitting out here, and we'll let them come in. This is a kind of a partial we had them make to give us something to go to, and these teeth will erupt into these partial teeth down below. And we got this all tied together. Now, some way or another, we have pulled these teeth in, and we put this artificial stuff down here. You have no space or anything like that. And we let her go for a couple of weeks or so and see if she bangs those teeth together when she talks or something. You don't want to get them past a point where they have room to function in making sounds and all this. So you have to kind of see that. But then we've got something on there where we can grind this stuff down, or we can add some more to it if we wanted to. And so you can judge that, and then these teeth will erupt into this when you take that off their mouth. There's the front of it. This was back in 95, looks like. And this is 97 when we were doing this. Now we've got her chewing on this and working on that, and we're kind of helping this go down by bending that wire down, and these are coming in contact like that. And so we continue with that procedure for a while. And this is the other side. There was absolutely nothing hitting in the back. Now this acrylic that you put on here, you put a row of it out here, and then you take a little thin thing and make the grooves, and it takes you about 30 minutes. You can build this thing in somebody's mouth in about 30 minutes. If you just bonded it all over those teeth. and she has to eat on this while these teeth are erupting into the contact, and then we put a partial back in the bottom down there to get it to work. Now, if you're really serious about doing this type of work, I can guarantee you there's so many people running around that have the money to pay for it, and you can charge whatever is necessary to do that, and you can straighten up things. People say, well, they're just going to work on young kids, and you run out of young kids sometimes. Learn how to do orthodontics and just take everything that comes to your office and learn how to do it. And so that's what I'm trying to get across to people all around wherever these videos go. This is I can't believe that you can reach out to people all over the world through this YouTube channel, you know, and I can show you what to do. And if I have lectured on this same stuff, some of these for 40 or 50 years, and there's very few people I ever touched with it. The people I had in the lecture, you have 20 or 30 or something, maybe 40 or 50, but you touch so few people in that way. And so now we're trying to reach anybody that's concerned about orthodontics and wanting to learn how to do it. I'm trying to do the best I can in showing you how we do this. Now, you talk about we're doing something that's wrong, it's going to be something change, but we're out on the cutting edge on a lot of this stuff. So I want you to try it, go back, study it good, and you've seen it done, and you can know it can be done. So this is 95, this is 97 now. We had a kind of a temporary partial made in here, and we're going to let the upper teeth come down and come in contact with that, and we just wear that. And when you get through, you may put a better partial in there, and I'll put something that kind of fits behind these teeth right here. We've got some little narrow area of teeth, and I can pull that together to some extent and close that gap right in there. So let's go on to, now here is the upper teeth, and you can see they had nothing in contact. There's one molar back here, a molar and a bicuspid, and another molar down here on the bottom. Now there's a, I wish I could move that picture of her to start with. If you remember, this lip line wasn't that far, but it was about like that. So this lady now has a vertical height of this face that is about a 1/4 inch more than she had to start with. And now that just looks better, and she can go in and get crowns or bridges or whatever she wants to do on her front teeth, and put retainers that hold it in place for a good while, but probably that's all it will take. And there's the bottom teeth. Now here is these false teeth that we just acrylic that we put up there, and has a base on it where she can chew against it. But you can see the height of the teeth. Maybe they may be a little bit longer than they need to be, but the lip comes up, and that's where her teeth are up here somewhere, and so you've lengthened that. And so we're just mixing orthodontics and restorative work. Now there's a lot of restorative work goes into this case, and if somebody is working on it that knows how to move the teeth and juggle them around, you can fix that portion of this. and that helps the person who does the restorative work. Otherwise, he's got to come up with some screwball thing here if he doesn't move the teeth that will do the same thing, or hopefully do it. It'll be harder to do. And now, let me see. Here is the vertical dimension after we lengthened it a little bit up there. And there's the teeth. These teeth, you take this loose, this will come on down and come in contact with these, and you keep this in there till that happens. Then you can remake these. I don't carry this one to the end of the treatment, but that is what happens in here. I'd have to be talking to you for an hour or two. But if you study these cases, they can be done. Just figure out a way to do them. And do this restorative and orthodontics on adult orthodontics. Some of you don't need any restorative, but you've seen a lot of them where we have just restored the person's mouth with orthodontics rather than putting implants or bridges or whatever in there. Nothing against implants and bridges, except the permanent teeth that you have. If you can move them into position, the bone will move in there and it'll harden up, and it's have just as good a bone structure as it was when you started. So I think, well, here we're biting down. Now these have come in contact. This is 98 right here, and we've got this level going right across. These need to come down and need to take this loose or bend this wire down and bring these teeth further down. Over here, we're fitting in good. And we've opened the bite, we've closed that diastema, we've got our height back with the teeth, and that's what we were trying to get done. There's that side, just a different view. And this is where she chews on this stuff, and you stay there till you get these. These look like crowns they're putting in here. She may go in and do some crowns here. If you wanted to, you could fill it in immediately with crowns, but those teeth will come together. Here, if you come in here and crown it, you can make a large crown in here and kind of close the spaces up and fix the mouth up better. A lot of people, excuse me, don't have money enough to go in and start from and scratch and put crowns and implants and stuff in there is expensive as heck nowadays. All right, that's everything in there. I hope you'll get something out of this video. If you don't want to do this, at least see that it can be done and take it to somebody else, or talk to somebody, or have a study club, and take these videos and y'all get together and study these things together, and you all try to do some of these adult cases. There's more adult orthodontics out there. There's just not enough orthodontists around to do all that needs to be done if you really get in there to doing it. But you're going to have to think about it and work with the case. They don't just fit to shoebox. And people that are doing jobs of kids, where there's nothing much, do them all the same way. This is not what I want to do. Take everybody you work on, and try to make that the best looking face you possibly can with what's there. So thanks for watching, and I'm going to sign off, and we hope you'll join our group and subscribe to it, and we're going to try to keep passing this stuff on, and I want you to work with study clubs and share this with other people. Thank you for watching now, and I'm going to close this out and say goodbye.